Hi friends, I'm here today with Dr. Garcia, and he's going to answer some questions that some of you have had. So, Dr. Garcia, he's my new friend also. And what are your credentials?
Good morning. Well, I graduated from med school 1998-99, if I'm not wrong. My specialty, I'm an educational sexuality teacher, and I do also clinical sexuality. So I have the specialty, then the master's, then I did a master's on biomedical science, and then functional medicine. So those are, in general, my credentials.
Great. And people want to know why the treatments that you do here, they're available here. Are they not available in the U.S.? Why do people come to your clinic?
A lot of the times, it's not that we, or you probably guys don't have them. If you follow the functional approach, where you're able to get a functional medicine doctor, you will be able to get some similar treatments. The only thing is that the immunological treatments, probably you're not going to be able to get them. We have a little bit more freedom to do things here that are not allowed in the States because of government regulations. Here we have a little bit of more openness to those things. The other thing is, if you're able to get them, they're going to be a lot more expensive down there than here. To give you an example, the prices for stem cells that I use, my patients are paying down here half of what they're paying in the United States. And also here I try to make a program for the patients for several days, not only to come and get the treatment and then go back home. I try to make an evaluation before. I try to nourish the body before, during, and after the application of the treatments.
Great. And what conditions are you people coming to see you for that are successfully being treated?
Most of chronic degenerative diseases. When I say that, I get to see patients that have cancer, patients that have arthritis, patients that have any autoimmune disease, patients with Parkinson's, with Alzheimer's. So I have to separate the cases, or analyze each patient, and from there we make a program for each patient. And not every patient will have always the same, because I have to check kidney function, liver function, whatever I see on the blood work is going to be modifying the program of each one.
Great. Yes, I know my treatment is very individualized, based upon my body and what it's doing. And it's been fantastic.
And then the general aspect of the patient as well.
Right.
And sometimes when I get patients with certain conditions, we deal more with complications from the disease than the disease itself. So we have to keep it balanced, and that's why each treatment has to be individualized.
Right. And I know a lot of people want to talk to you. Do you charge a consultation fee?
No, not really.
And how would people contact you to find out?
Usually my cell phone number. I try to make things easier for my patients, because even for me, if I were, like today, I had to do an appointment with my eye doctor and the dentist, so I lost one piece by eating beans and rocks. And so...
What about bugs?
Yeah,
No?
those are great. That's what helped me. And so I had to speak with the secretary. They will make an appointment, so it's complicated. So I usually give my cell phone number to my patients, so they can either send me a WhatsApp message or call me directly. And most of the times I answer. If I don't answer immediately, I will try to call back as soon as I can. I usually recommend WhatsApp, because the message will stay there and I know what to reply right away. Otherwise, sometimes I get the phone call, and if I don't see the phone call often, I will forget about it because I'm running most of the time. But if you send me a message, it will be easier. And then I save your phone number, and I always tell my patients, there's no excuse. You can reach me any time of the day, any time of the day, any day of the week, sorry, or any time of the day, any day of the year as well.
Right.
If I don't answer, I might be busy, but I will get back to you for sure.
Yes, I've experienced that. You're very, very good at communicating. So
Thank you.
Thank you for taking the time to answer my questions.
It's a pleasure.
And it's been a pleasure to work with you. Thank you.
It's been a pleasure to have you here as well.
Okay.